All right, the Health Minister, Dr. Motsoaledi, then, as I've just mentioned to you, is hitting back hard this afternoon at allegations that the public health system is on the verge of collapse. You would have heard us a little earlier, Mzukisi Grootboom from the South African Medical Association, warning that it is heading for financial disaster. Those remarks echo those of the Health Ombudsman, Professor Malegapuru Makgoba, who's investigating thousands of complaints. eNCA's Aldrin Sampear is covering that angle of the story for us this afternoon. Aldrin, good afternoon to you. Now, I'm not exactly sure whether the Health Minister has addressed or is about to address these allegations, but whichever way it is, he is going to come out and deny very strongly, I imagine, that the sector is in crisis.
Well, certainly. In the next few minutes, that's when that press briefing starts. It starts around about 2 o'clock this afternoon, where he will give us more details with regards to these assertions that the health system in the country is in crisis. One has to emphasize, though, that there have been isolated incidents of crises that have been pointed out. If you look at KwaZulu-Natal as well as in Gauteng, and then, of course, looking at what's happening in the northwest, where you still have the South African National Defence Force, the SANDF's Health Defence Force arm being still deployed in the northwest to deal with the situation there. And then, of course, also as we heard during the Modisa network, Professor Makgoba also going to the Eastern Cape to deal with what he calls the potential life esidimeni crisis that province is facing at the moment. He also spoke, for instance, about the issue around how many complaints he has received when it comes to the health system in the country. He said about 2,000 complaints that he has received as the Health Ombudsman, and about 800 of these complaints coming from Gauteng alone. But today we will get more details with regards to this crisis, or indeed whether it is a crisis. Yesterday, when the Human Rights Commission went to the Steve Biko Academic Hospital, the management from that hospital denied the assertion that there is a crisis at that hospital. The oncology ward is facing a crisis. That's the reports that we have been receiving, and that's the complaints that the Human Rights Commission has also been receiving. You also know that the Human Rights Commission is also investigating a similar complaint also in KwaZulu-Natal, dealing with the oncology ward.
Whichever way the Minister, Aldrin, addresses the scale of the problem, it is fundamentally going to come down to two things, though. One is funding, and we can talk about the National Health Insurance Scheme in just a moment, or simply do state hospitals have enough capacity? And one senses it's going to be a combination of those two issues that he is going to have to address this afternoon.
Well, certainly, when you speak about the issue around funding, you'd remember that what the government is trying to push for right now is to ensure that they curb these medical claims that they have been receiving. That number now standing, I think, at around 521 million rand, and there's a potential of it increasing to over R1 billion. And this, as I read in one of the reports of the daily newspapers today, is that it comes to about a quarter of government's health budget that has been given to the health department to deal with issues health related within the department. When you look at the Eastern Cape, for instance, and yesterday when I spoke to the Eastern Cape Social Development Department with regard to this contract that they have with the Life esidimeni Group, or the Life Group rather, which there's a subsidiary is the Life esidimeni Group, the Social Development Department is making the argument that although it is their competence to make sure that they give funding to these centers that look after people, to look after the frail, for instance, and to look after people who are people who suffer from a mental state. However, though, the problem that they face is that what you find that in this province now, this is the Eastern Cape, that its budget from the Social Development Department has now been moved to help the healthcare or the health department to help it curb its budget at the moment. They have to deal with the issues around the issues around oxygen, which is a competency of the health department. Instead, it's the Social Development Department that has to deal with it. And certainly we'll hear the minister speak about that. But I think quite important as well, what we expect the minister to speak about as well is the powers that he has. And this is something that he has been talking about, and the Health Ombudsman has been talking about as well, and saying that the minister does not have enough power to intervene when the the health departments of the various provinces face crises, that the minister can only intervene at a later stage. The minister has said before that there should be an amendment to the constitution, amendment to the legislation, and the Health Ombudsman has also reiterated that call, saying that there should be an amendment to the constitution of the country. But it also brings into question, Jeremy, the question around when does intervention become interference? And I was having this discussion with Tula Sizwe yesterday as well, that if you look at the Public Broadcasting Act, for instance, where the minister's powers are being curbed, that the minister should rather be consulted when it comes to the appointment of the executive, when does one then say that there is too much interference in the appointment of people who head these departments? The Minister of Health has said that he wants powers to be able to be consulted when it comes to the appointment of the MECs of Health. Because if you look at the appointment of the MECs of Health, most of them are not people who come from a medical background.
Aldrin Sampear, thank you very much indeed.